Hey everyone, welcome back to my channel. I'm Amanda Shee. I'm an anesthesiologist and intensivist, and today I want to talk about the realities of being a woman physician in modern society. So even though the gender gap in medical school classes has seemingly disappeared, so most classes are actually 50-50 in gender, and in some situations, in some years, there were actually more women than men enrolled in medical school. The reality is there are still biases and challenges that women face when they go out into practice as a physician. In this video, I want to go over some of those realities that I personally have experienced, as well as some of the data that's out there about being a woman physician. I always get asked when I talk about the fact that I'm very active in the American Medical Women's Association, what the relevance of this organization even is. And while the majority of the time, the place that I practice and the experiences I've had have been overwhelmingly positive, there are definitely still situations in which I can tell and I can feel different as a woman physician. So let's just dive into it. The first thing that is a reality of being a woman physician is that no one assumes that you are the doctor. For example, I have been an attending, so I'm done with training for a couple of years now, and I remember going to the preoperative, so where patients come in order to get ready for their surgery. That's where they meet their anesthesiologist and their team. When I went in to go meet my patient, I had a tall male medical student with me, and the patient immediately focused all of their attention on the medical student. Despite the fact that I introduced myself as Dr. Amanda Shee, your anesthesiologist for today, didn't matter. Everything I said was not really listened to. I could tell that the focus of the patient was 100% on the tall male medical student that was with me. And another situation that has arisen too is one time I was with a male resident. We went to go see a patient, and the patient kept asking the resident about their overall care. The patient kept directing their questions at the resident and directing some of their care things, such as asking for a tissue or asking to be suctioned, to me. And while I'm happy to do these things because I do them all the time when I care for my patients in the operating room or in the ICUs, it also demonstrated just this automatic role bias and generalization that comes with being a woman that I encounter all the time. People assume that I'm gonna be the one to help them get up, go to the bathroom, that I'm gonna be the one to suction, to clean them off. And these are things that I am happy to do, and I continue to do it. If I see something that I can help with, I 100% do it. But at the end of the day, my role is to oversee a patient's care or direct their care. And sometimes those types of tasks can actually take away from the big picture of caring for a patient. So these are some of the things that kind of come up. The other thing too is in the environment I work in the operating room, the realities are that most of the time the men are surgeons in the operating room, and the women in the operating room are typically nurses or nurse anesthetists. And I am so happy to work with all of them. But the reality is that when I walk into the room, the automatic assumption is I am not the doctor or a doctor of any sort. And again, this kind of goes with the operating room environment in that in the operating room, oftentimes patients refer to the doctor as surgeons, and anesthesiologists are frequently not realized or recognized as physicians. So these are some of the little things that, while I recognize and I'm very appreciative of some of the individuals that make it very clear to the patients on my behalf. So for example, the resident I had worked with had immediately corrected the patient when the patient was directing and asking, oh, are you the one that is overseeing my care? That particular resident said, no, 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 she's the boss, and pointed to me. And so I appreciate those kind of comments, and I recognize that everyone is doing their part to change the culture and change the assumptions and biases that exist. But at the same time, when you keep encountering it over and over and over again, it gets to be kind of tiring. The second reality of being a woman physician or doctor is that there are fewer role models in leadership positions for us to be able to reach out to be able to get advice from, to be able to be mentored or sponsored in order to achieve our goals as women physicians. Actually, there is data that says that only 3% of healthcare CMOs are women, only 6% of department chairs are women, and only 9% of division chiefs are women. So there are definitely more than those numbers in terms of percentage of women that are practicing today. So this doesn't reflect the practicing physicians today. The number of leaders that are in positions right now that are women does not reflect the practicing population. And so this is definitely a big issue. So I personally want to work in administration. I want to get a role within administration. And one of the big things is that I need role models and I need people that I can turn to help guide me and guide my individual kind of path to those goals. Now, that's not to say that I can't go to my male colleagues, and I have had so many incredible male sponsors that have helped me get to where I am today. But at the same time, there are specific things that women have to face that men don't, such as childbearing, and oftentimes the assumption of child rearing and household duties fall upon women. So there are certain things about getting advice and getting mentorship from individuals that have somehow figured that out, cracked the code, or maybe didn't figure it out, but it can at least assure those of us that are trying to achieve those roles or get to those roles that there's a way to do it. It just may not be pretty. That all being said, I do still appreciate and I recognize that our male counterparts are there to help and change the system and the culture to be able to get more women into these leadership positions. The third thing that is a reality of being a woman physician and or just being a woman in medicine is the stigma / negative connotation / sometimes resentment that comes with childbearing. So even though it has gotten a lot better, when I talk to some of the other AMWA or American Medical Women's Association members, some of the more senior members that have seen it all, that had been a part of classes that there were only a couple of women or they were one of the only women in their medical school classes. When I talk to them about this, many of them state that they wouldn't dare or they had to plan aggressively in terms of childbearing because they didn't want to seem like they weren't pulling their weight. And yes, there is a significant impact on a practice if one of the physicians or attendings can't take call or has to go on maternity leave. That is a reality about our practice and about healthcare in general. But one of the interesting things I've actually heard along the way about how to think about women having children and that time that is taken out of work is that while women oftentimes have to take time off in order to give birth and recover from that process as well as bond with their babies, that is something that happens earlier in a woman's career. However, oftentimes men actually encounter a lot of healthcare issues as they grow older that the women have to cover later on. And that was actually said to me by a male colleague once, and I thought, wow, that's actually really true. And at the end of the day, all of us are going to encounter some sort of event, medical thing, some sort of life-altering thing that we need to potentially take some time off. So I think that it's really important that all of us recognize that we're in this together and each of us are going to have to potentially pull a little more weight for a period of time to help one of our colleagues, because at the end of the day, when one of us, or if I myself need to take that time off for something, I would want to know that my colleagues are there and have my back. So it is something that is a challenge because men don't give birth and they don't rear children, but it is something that I think can be changed and has been changing, but is still kind of a reality today. I have heard and I do know that there's definitely people that still talk about, oh, I can't believe so-and-so is having a baby right now. I can't believe X, Y, or Z is going on. Oh my God, they had to go out for maternity or they had a complication and they've been out, so I have to take all this extra call. That kind of attitude, that's the stuff that needs to change. And that's the stuff that actually really can wear women down and make them think, oh, maybe I shouldn't have children, even though that may be something that is really important to them or is a priority in their life. And so that's one of the realities that I think is important to consider, because while there are a lot of practices and there's a lot of places that are really accepting of women that want to have children and families, there are still individuals or there are still cultures that are not as accepting. The fourth reality of being a woman physician is the whole imposter syndrome thing. Now, I really do believe that imposter syndrome can affect anyone regardless of gender, but I do feel that a lot of women that I work with or encounter both on a pre-medical, medical student side or residents, current staff, I do hear some of these comments that are really identify or that really demonstrate this imposter syndrome. So for example, I myself totally suffer from imposter syndrome. I 100% still don't think I belong at the institution I'm practicing at. I still 100% cannot believe that I actually matched at the residency program that I trained at. These things continue on day to day, even though I'm doing the job. I clearly was hired on at my residency program as a staff member. I get some positive feedback, so I can't be totally off base, but every day I still feel like I don't belong here. I am among people that are so much smarter than me that I have no value added in these situations. But reality is that's not the case. I just feel that way internally. Another example of this is that I realize that when I'm listening to some of my colleagues, they are really proud of the things they've done, some of the accomplishments they've had, and they talk about them. And I personally don't do that. I don't share my accomplishments or do that whole self-promotion thing. That's not something that I am comfortable with. And I think that a lot of women feel this way as well, that self-promotion seems like it's disingenuous in some way or that it is bragging in some way. And I don't think that that's really the case. Oftentimes, by sharing your accomplishments and sharing what you do and your passions, it actually opens doors for more opportunities in the future. But because women, or at least I know I don't do these things, I find that I may have been missing out on some of these things. When my colleagues find out that, wow, you've been running a conference for almost 10 years now, and you've been overseeing the budget and being able to turn over a profit in that, like, that's incredible. These are things that I don't typically share, and as a result, it becomes a surprise when I do share it in situations where, for example, I recently applied for some leadership positions and had to interview for them, and there were a lot of surprised individuals when I shared some of the work that I've done outside of the institution that's not totally readily available. The other part of the imposter syndrome component as a woman physician is that I actually do hold myself back from applying for certain positions because I don't think I'm qualified. Whereas I find that some of my male counterparts feel a little more comfortable with proceeding with an application, even though they don't necessarily meet all of the criteria that are listed out for that position. And so I do find that I think that I internally actually hold myself back. Recently, I actually wasn't planning on applying for something until someone else had taken me aside and said, you would do a really great job with this. I think you should at least check it out and try. And I really appreciated this individual taking me aside, who was also a woman, and saying that I had the qualifications and that I really should consider putting myself out there and trying for this position. So that's another kind of reality that I think a lot of us face in medicine and as women. The fifth reality of being a woman physician is that I do feel like sometimes I encounter women not supporting other women. And I can't explain what it is about the environment or about the potential that individuals are threatened somehow, but I find that sometimes there is this feeling that there's jealousy or that there is negative talk about colleagues that are being successful in certain ways or that are making moves or achieving things. And that type of talk can really tear people down and can really make for an environment that is not conducive to progress and community and moving things forward. And so I think it's really important that we all support each other. And I make a point, especially since I've been in AMWA for so long, to really applaud my colleagues, to really point out to the women that I work with in any role group. So, you know, the nurses I work with, the CRNAs I work with, the medical students, the residents, the fellows, everyone, I make a point when I'm around other women to really talk up or try to highlight some of the great things about them or about other colleagues that are women that are doing a good job. I think it's so important to do this stuff because I do know and have seen this type of culture permeate as I went through training, as I was a medical student, as a pre-med, and that's just not something that helps women want to stay in this workplace. And so it is so important to recognize that this is a reality in some places, and personally, and I think also be able to just think about it and recognize it so that if you have that self-awareness and insight, that you can then move forward and say, oh, actually that comment may not have been the nicest thing or may not have been necessary whatsoever. How do I make it so that this is a positive thing, that we can support each other and cheer each other on? And finally, the sixth thing about being a woman physician is that we still get paid less than our male counterparts. In fact, this article kind of highlights the big picture gap that happens because of this gender pay disparity, and it's in the order of millions. That's right, over a lifetime or over a career, women can lose out on millions of dollars just because we're paid less than our male counterparts. That's something that I hope we can really work on, because that's just not fair. And I don't think I need to really belabor this point, but losing out on millions of dollars just because of our gender really doesn't make for a very enticing career in healthcare. And so this is something that I think, now that we've had more recognition of the gender pay disparity and there are individuals in leadership positions that recognize it, that we are able to move the needle a little bit. But I still believe that the reality is out there that many of the things that I kind of said earlier, things like imposter syndrome and other things, actually prevent women from going and asking for the raise that they deserve, going and asking for that leadership position that they're qualified for. And that adds to the pay gap that exists between genders. Now, any studies that are done for these type of numbers that are shared typically account for the differences in hours worked. So we don't have to worry about that component. It's not about, oh, women are out having babies, so therefore they don't get paid as much. These things are accounted for in these studies. And at the end of the day, the numbers keep coming back out that women get paid less than men in medicine. So we need to work on that. Now that was 6 things, 6 realities of being a woman physician. I really want to point out, though, that we have made a lot of progress in equity and gender equity and being able to move the needle forward and change the culture of being a woman physician and being able to work in healthcare in such a way that is welcoming and that is conducive to a long-term career in healthcare. So there's hope, and things are changing. They continue to change. Anytime I speak to some of the more senior members in AMWA, I'm reminded of how much has already changed in just a few decades. But there's still more work to do, and I thought that I would share some of the things that we continue to need to work on. So I hope this video was interesting to you. Give me a thumbs up if you enjoyed it. If you want to hear more from me in the future, please subscribe to my channel, and I will see you guys next time.